health department and their epidemiologists being able to present this plan to you today. From the Kingsport operations manual that we've released to our community here this morning, we also have had a lot of other liens added to that. And at the last page in our operations manual, you'll see a lot of those contributors. But we, along with those medical groups that contributed to the information, we had parent groups, we had teacher groups, principals, and community partners that we met with over a period of time as this was being developed. And each one of those groups added a special lens to help us to try to develop our operational plan in Kingsport down to a granular level. I would still say that there's as families look through that, what I encourage the families in Kingsport to do is look through that plan. As they continue to see questions that haven't been answered, because it's hard to anticipate all those different types of questions, we are asking our parents to send that information to info@k12k.com. Those questions that filter into that website or to that email address will help to start formulating and populating a frequently asked questions document that we'll follow up with on things that maybe we just haven't had it, with all those different lenses, it's still hard to take into account all those things. I know that as they look through there and they get some of those answers, some of our families still will have questions and interest about the opportunity for virtual learning. And we'll be rolling that information out in Kingsport for virtual opportunities starting on Monday, so that those families will know what those opportunities are in Kingsport. I know that there's been many prayers, petitions, and efforts by a lot of people to present the plans that we're presenting today on behalf of Sullivan County and then specifically for Kingsport. All of those have been focused on the ability to provide a safe environment for both students and staff to come back. As was shared, as you see those numbers on the EpiCurve on the website, the things that we can ask of our community at this time is help us to do practices that drive our numbers down. The closer that we can get our numbers down, the more flexibility we have in providing as regular an environment as we can in this day and time. And so with that, we'd ask that our communities help us to do everything that they can to help us to get those numbers so that we can, again, have as much flexibility as possible.